Hello, good day. My name is Dr. Chudi Ufondo of ATG, and today it's another wonderful day. Today we'll talk about the function of the fallopian tubes. So today we'll be looking at the fallopian tubes, and we'll discuss the functions of the fallopian tubes and what can happen if the fallopian tubes, for any reason, has any problem. So naturally, every woman has two fallopian tubes, and mechanically the fallopian tubes it's made in such a way to aid in conducting the egg that will be released from any of the ovaries. So every woman has two ovaries. So the function of your fallopian tube, one of the functions is to conduct the released egg, make sure it gets to inside of the tube. Then another function of the fallopian tube is to allow the semen. So when a man in course of lovemaking ejaculates, ejaculation means pouring the semen in the vagina. It will go through the cervix, get into the womb, then go through an opening in the womb into the tube. There is a special place in the tube called the ampulla. So this is where fertilization will occur. Fertilization is simply the union of the egg and the sperm to form what we call embryo. The union of the egg and the sperm, once the embryo is formed, that's the beginning of the journey of having a baby. Conventionally, when this happens, it's expected that that embryo will now begin a downward journey into the tube, the cover of the into the womb. The cover of the womb is called the endometrium. So a successful fertilization and pregnancy that occurred in the tube will continue to the womb to go through the process we call implantation. So anything that happens in course of the tubal functions, if there's any effect, so if the tube is blocked on this end, the eggs cannot come in. If the tube is blocked on this end, the sperm cannot come in. If for some reasons this side is not blocked, this side is not blocked, and both of them finally form an embryo, but it cannot go further down because of blockage, then the pregnancy will start developing in the tube, which is not supposed to be, which is deadly. When the pregnancy is developing anywhere outside the womb, is called ectopic pregnancy. So the pregnancy that develops in the womb is a type of ectopic pregnancy, and that's the commonest type of ectopic pregnancy. It's called tubal pregnancy. So you can see that your tubes are very important. So here's the deal. If for any reason one of your tubes got damaged, you can still compensate with the other healthy tube. So for a woman to become pregnant, she needs at least one functional tube and one functional ovary. If this side is completely damaged and this side is okay, that woman can still become pregnant. That woman can still have twins. That woman can still have any number of babies that woman can have. The only thing is the chances of conception has been reduced, but you can still become pregnant. So this is the natural original function of the fallopian tubes. Now, coming to the things that can affect the fallopian tubes. If in the past you had untreated or poorly treated sexually transmitted infections, of which we are interested in two particular bacterial infections, chlamydia and gonorrhea. If you had untreated chlamydia or gonorrhea and it went to your tubes, they love the tubes. They can go to the tubes and they can lead to what we call pelvic inflammatory disease. Pelvic inflammatory disease can block and lead to adhesions inside the tube. Because the tube is very sensitive, anything that affects the opening, the normal structure of the tube, of which the chlamydia and gonorrhea are mentioned about, can lead to this. Any blockage in the tube will affect its function. It can either affect the egg from coming in, it can affect the sperm from coming in, or it can lead to ectopic pregnancy when the pregnancy is in the tube instead of going back to implant in the womb. So it's important you treat your sexually transmitted infections, including HIV. Some sexually transmitted infections will not give you any sign. So it's important when you go for your well woman check, you make sure that everything is properly checked. So long as you're sexually active, it's your responsibility to make sure you keep an eye on STDs. Very, very, very important. This is one of the most important factors in becoming an adult. So that's number one. Some people can have humongous fibroid. So fibroid is an abnormal growth in the womb. So some people can have a fibroid that can actually be so big to occlude the tube at this juncture. When that happens, it can also lead to blockage of the tube. Also, if any surgical procedure was done in the pelvic region and it heals with adhesions, they can also affect the tubes. So your tube is very, very important for you to achieve pregnancy. And it's not just enough to have fertilization in the tubes. After fertilization, the embryo must come back and implant in the womb. Until that embryo is implanted in the womb and is confirmed the woman is pregnant, that's not a completed pregnancy. Once everything is achieved, the embryo goes to the womb, implants, and everything is okay, that pregnancy will proceed normally without any problem. So long as the hormones and every other factor that will lead to normal development of the embryo, which will form a baby, is checked. So your fallopian tubes are very important. Now here's the deal. So many people will be wondering, so what do we do if our tubes are blocked? It depends on the level of blockage. It depends on the extent of blockage. So if you have a mild blockage, when you go for your HSG, which stands for hysterosalpingogram, that fluid they use in doing that procedure can dislodge whatever blockage they have there. Or if you have mild blockage, you can also go for mild, little invasive surgery to correct that. But the problem with that is the fact that anytime you're operating on the womb, you are likely going to create scar tissues, which is adhesions, which can further worsen it. The good news is the fact that if for some reasons one of your tubes got blocked, but the other side is open, you can still become pregnant. Unfortunately, if both sides are blocked, then you need to go for ART. ART stands for Assisted Reproductive Technique. So the fact your tubes are blocked doesn't mean you can't become pregnant. It means you need further help. So if you have been given any diagnosis of blocked tubes, whether it's unilateral or bilateral tubal blockage. So unilateral tubal blockage means one of the tubes got blocked. Bilateral means both sides got blocked. The worst case scenario is to have both sides blocked. But if one side is blocked, the other side can also lead to ability to become pregnant. So your tube is very important. Please, if you have this diagnosis of tubal blockage, the earlier you seek help, the better. Unfortunately, if you've had ectopic pregnancy, that part of the tube you had ectopic pregnancy will likely go. We remove it surgically. An ectopic pregnancy is an emergency that must be reported to the doctor immediately, and the surgery must be done immediately to save the life of the mother. So tubal factor is a very important factor in female fertility, and it can be handled, but time is of essence. So it's important you heed to the time and you act properly. Thank you for coming today, and thank you for tuning to ATG. And please remember to learn, practice, and achieve. Have a good day and bye-bye for now. God bless.